Ebstein's anomaly is a rare congenital heart defect characterized by abnormalities in the tricuspid valve, leading to its displacement into the right ventricle. This condition affects individuals of all ages, from infancy to adulthood, and can vary widely in terms of severity and clinical presentation. Understanding the epidemiology, embryological basis, classification systems, clinical manifestations, diagnostic imaging modalities, genetic factors, pathophysiology, hemodynamic consequences, medical and surgical management options, long-term outcomes, and reproductive considerations is crucial for providing comprehensive care to patients with Ebstein's anomaly. Ebstein's anomaly is a rare heart defect. It accounts for 1 to 2% of all congenital heart diseases. It occurs more in Caucasians. The exact cause is unknown, but genetics and environment may be factors. Studying its worldwide incidence, prevalence, and demographics is essential for public health and resource allocation. During the development of the heart, various cellular and molecular processes occur. Ebstein's anomaly is caused by specific developmental abnormalities, particularly the malpositioning of the tricuspid valve in the right ventricle. Understanding these abnormalities sheds light on the structural aspects of this condition. Several classification systems have been proposed to categorize the severity of Ebstein's anomaly and assess its clinical impact. The most commonly used classification system is based on the Carpentier's classification, which divides Ebstein's anomaly into 3 types: Type A, Type B, and Type C. Each type reflects the extent of tricuspid valve displacement and the presence of associated cardiac abnormalities. Assessing the severity of Ebstein's anomaly is crucial for determining appropriate treatment strategies and predicting long-term outcomes for affected individuals. The clinical presentation of Ebstein's anomaly can vary widely, depending on the severity of tricuspid valve abnormalities and the presence of associated cardiac defects. In pediatric patients, symptoms often manifest early in life and may include cyanosis, failure to thrive, respiratory distress, and arrhythmias. In adults, symptoms are typically milder and may include fatigue, palpitations, exercise intolerance, and signs of right-sided heart failure. Recognizing the various clinical manifestations of Ebstein's anomaly is crucial for early diagnosis and appropriate management. The diagnosis of Ebstein's anomaly relies on echocardiography, cardiac MRI, and CT scans. Echocardiography provides detailed information about the tricuspid valve and associated abnormalities. MRI and CT are used for further evaluation and surgical planning. Understanding these modalities is crucial for accurate management. Recent research has shown that genetics plays a significant role in the development of Ebstein's anomaly. Specific genes related to heart cell development, cell adhesion, and ciliary function have been implicated. Additionally, familial patterns have been observed, indicating an increased risk for individuals with affected family members. This knowledge of genetic factors and inheritance patterns can contribute to better understanding the causes of Ebstein's anomaly and may be significant for genetic counseling and family planning. The abnormal function of the tricuspid valve in Ebstein's anomaly is a central feature of this condition and contributes to its clinical manifestations. The displacement of the tricuspid valve into the right ventricle leads to a spectrum of abnormalities, including tricuspid regurgitation, reduced effective orifice area, and impaired right ventricular systolic function. Elucidating the mechanisms underlying the abnormal tricuspid valve function in Ebstein's anomaly is crucial for understanding its impact on cardiac physiology and guiding treatment decisions. Ebstein's anomaly can have significant hemodynamic consequences due to the abnormal tricuspid valve function and associated cardiac abnormalities. The displacement and dysfunction of the tricuspid valve can result in altered blood flow patterns, increased right atrial and right ventricular pressures, and reduced cardiac output. Analyzing the physiological consequences of Ebstein's anomaly on cardiac output and hemodynamics provides insights into the overall impact of this condition on cardiovascular function and guides management strategies. The medical management of Ebstein's anomaly aims to alleviate symptoms, improve cardiac function, and prevent complications. Pharmacotherapy plays a role in controlling congestive heart failure symptoms, optimizing cardiac rhythm, and managing associated arrhythmias. Medications such as diuretics, beta blockers, and antiarrhythmic agents are commonly used in the management of Ebstein's anomaly. Understanding the available medical treatment options and their role in symptom control and arrhythmia management is essential for optimizing outcomes in affected individuals. Surgical treatment is common for severe Ebstein's anomaly. The choice of surgery depends on disease severity, associated abnormalities, and patient factors. Procedures like tricuspid valve repair, cone reconstruction, or replacement can be used to optimize outcomes and prognosis. Understanding the long-term outcomes and prognostic factors associated with Ebstein's anomaly is crucial for assessing the overall impact of this condition and guiding patient management. Long-term studies have indicated a wide spectrum of outcomes, ranging from asymptomatic individuals with minimal disease progression to those with severe cardiac dysfunction and increased morbidity and mortality rates. Prognostic factors, such as tricuspid valve function, associated cardiac abnormalities, and the presence of arrhythmias, play a significant role in predicting outcomes and determining the appropriate management strategies. Pregnancy in patients with Ebstein's anomaly presents unique challenges due to potential risks to both mother and fetus. Careful monitoring, management, and counseling are essential for optimizing outcomes. Understanding reproductive considerations and risks is crucial for comprehensive care. Ebstein's anomaly is a complex heart defect. Understanding its causes, symptoms, diagnosis, treatment, and long-term outcomes are crucial. Research and collaboration will help improve our knowledge and care for patients with this condition.